Okay, guys, this is B for y'all. Discussion B deals with the American senior health crisis going on about people's health span, uh, discrepancy between lifespan and health span. So here we go with tonight's discussion B. Please join me in in the presentation, please. Thanks. Okay, so we're gonna start. The text highlights a concerning trend in the US. In the United States, while people are living longer, the number of years spent in good health is not increasing at the same rate. This discrepancy between lifespan and health span, the years lived in good health, is growing wider in the US compared to other countries. Between 2000 and 2019, life expectancy in the US increased slightly for both men and women. However, the health justified adjusted life expectancy, which accounts for years lived without disease or disability, showed normal improvement for men and no changes for women. For example, in 2019, American women lived an average of 80.7 years. Okay, next page. Down we go. Straighten out. Okay. But the last 12.4 years of their lives were often burdened by disease or disability. This widening gap has significant implications for public health and policies, emphasizing the need to focus not just on extending life, but also improving the quality of those additional years. A widening, a wider health gap where the years of good health span lag further behind life expectancy can lead to several significant consequences. Increased healthcare costs, people spending more years with chronic illnesses or disabilities requires ongoing medical treatment and care, sustaining both personal finances and national healthcare systems. Okay. Down. Economic impacts. A less healthy population can lead to reduced workforce participation and productivity, impacting the economy overall. Inequality and discrepancies. Health inequalities often align with social economic factors. Maintaining a diverse group groups bear the brunt of the health gap. This can widen social and economic divides. Okay, lower quality of life. Individuals experiencing longer periods or of poor health often face physical, emotional, and social changes, significantly diminishing their quality of life. Public health challenges. The growing burden of chronic disease and disability necessitates more comprehensive public health strategies to improve preservation, early diagnosis, and effective treatment. Addressing the health gap requires shifting focus from merely extending life to enhancing the quality of those years through improved access to health care, healthier lifestyles, and targeted policies for reducing health discrepancies. The health gap disproportionately impacts low income communities due to several interrelated factors. Limited access to health care. Low income individuals often lack insurance or face barriers to addressing affordable quality health care. This can delay diagnosis and treatments, worsening health conditions. Higher prevalence of chronic conditions. Socioeconomic changes such as poor hold on, folks. Next page. Okay, housing, limited access to nutritious food, and unsafe working conditions contribute to higher rates of chronic diseases and disabilities. Financial strain. Managing long-term health issues can be financially devastating for low-income families, leading to increased debt and reduced economic stability, reduced lifespan and health span. The combination of poor health care access and adverse living conditions shortens both the years lived and the years lived in good health in these communities. Intergenerational impact. Poor health outcomes can perpetuate cycles of poverty as chronic illness affects earning potential, educational opportunities, and overall family well-being. Okay. Addressing these discrepancies requires systematic changes, such as expanding healthcare access, improving public health, uh, in infrastructure, and targeting social uh, detriments of health. Without these interventions, the health gap will continue to exacerbate inequalities in low-income communities. Improving healthcare access requires a multifaceted approach that addresses systematic barriers and promotes equality. Here are some key strategies. Expand insurance coverage, increasing the availability of affordable health insurance through programs like Medicaid expansion and subsidies for low-income families can help more people access necessary care. Okay. Enhanced telehealth services. Telemedicine can bridge the gap for those in rural or underserved areas, offering consultations and follow-ups without the need for travel. Increase healthcare workforce, addressing physician shortage by expanding medical education opportunities, offering loan forgiveness, and encouraging foreign trained doctors to practice can improve access. Invest in community health centers, shortening or strengthening local health facilities ensures that underserved communities have access to primary and preventative care. Access social detriment of health. Tracking issues like transportation, housing, and food insecurity can remove barriers that prevent people from seeking care. Just 1 second, guys. Okay, last page. Promote health literacy. Educating individuals about navigating the health system and understanding their healthcare needs empowers them to make informed decisions. These measures, when implemented correctly, can significantly improve healthcare access and outcomes for all. Which of these do you think would make the biggest difference? Okay, guys, so that's it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.